reaction occurs.
Whenever
It is
a person
imperative
takes
that you always
medication,
tell the
there
healthcare
will be an
providers
effect.
and the
The
pharmacists
drug's
about
desired
any
effect
allergies
is
you
called a
have
therapeutic
and what
response.
happens when you come in contact
An
with the
adverse
allergen.
reaction, also
An
called a side
idiosyncratic
effect or
response
adverse
happens
effect,
when the person
is
reacts to a
undesirable
medication
and harmful.
and it is not due
The
to the
adverse
properties of the
reactions
drug
can range
or
from
from an
mild,
allergy.
which disappears
This
when the
type
drug
of
is
adverse
stopped,
reaction is
to a
specific to the
debilitating
person
disease
and
that
sometimes
becomes
has a
chronic,
genetic
or
cause.
death. Adverse reactions can appear shortly
Even
after
though an
starting
Epi-Pen
new
uses a
drug,
needle to
but may
administer,
become less
the
severe
rules in
with time.
Chapter 65
Often the
G7
risks
allows you to give the
associated with
medication
the
in
side
emergency
effect is weighed
situations.
against the benefits
How
gained
to
from
use an
taking the
Epi-Pen.
medication.
1.
The
Prepare.
potential for adverse
Remove the
reactions
Epi-Pen
when
from the
starting a
clear
new drug
carrier tube.
is the reason
Hold
you
it
are
in your
required to
hand with
closely
the orange
monitor
tip
the
pointing
individual
down.
for 20 minutes
Remove
when
the
he or
blue
she
safety
begins a
cap
new
by pulling
medication.
straight up. 2.
Adverse
Administer.
drug reactions can
Hold
be
the
grouped
person's
into one
leg
of two
firmly for
categories:
administering to a young child
dose-related
or
or
someone who
patient
may try to
sensitivity
move during
related.
the injection.
Most reactions
Push
are
the
a result
auto-injector
of known
firmly into the thigh
pharmacological
muscle until
effects
it clicks.
of the drug and are
Hold
usually
firmly in place
dose-related.
for 3 seconds.
Let's look at the
I
4
like to
types
count
of
to 10 to be
dose-related
sure there's enough
reactions:
time for the medication
secondary
to be
effects,
totally injected.
hypersusceptibility,
Massage the injection
overdose, and
site for 10
iatrogenic
seconds.
effects, which are
3.
caused by a
Get
medical
emergency medical
examination or
help
treatment.
right away.
Most medications have a major
Remember,
therapeutic
the
effect as
Epi-Pen
well
is an
as a
emergency
secondary
treatment but
effect
doesn't fix
that
the
can be
problem.
beneficial
The
or
person could
adverse.
experience symptoms
Morphine
again
is an
in as
example
little
of a
as 5
secondary
minutes.
effect that are
Call
adverse.
911 right away.
Morphine does a
The
good job
person
of
will need
relieving
additional
pain,
treatment
which is
for
a
severe
therapeutic
allergic
effect.
reactions.
However, it
1.
has 2 undesirable
Antihistamine,
secondary effects of
usually Benadryl.
constipation and
An
respiratory depression.
antihistamine stops the histamine
Benadryl is
reaction
an
that causes
antihistamine.
respiratory issues,
Depending on the
swelling,
situation,
and
its
drops in blood
secondary
pressure.
effect of sedation
Oral
may be
doses work as
beneficial
well
if
as
you're trying to
IV,
get to
but
sleep,
they don't work as
or
fast.
detrimental if
Give
you
the
need to
dose by
stay
mouth
awake
if
and
ordered,
alert.
and the person can swallow without difficulty. Be sure to
Hypersusceptibility
let
occurs
EMS
when a
know
person
how
is
much you
given the
gave
usual
and when you
therapeutic
gave the
dose
medication.
and
2.
experiences an excessive
Steroids,
therapeutic
IV
response.
and PO.
Again, let's look at the drug
Steroids are
morphine.
initially given IV.
The usual
Then
IV
the
dose
doctor
for
may
the
prescribe an
typical
oral
adult
steroid
is
like
2 to 10
prednisone for a
milligrams
period of
titrated
time
to
after the
effect.
reaction.
I have
This
taken care
varies
of
with the
patients
severity
that
of the
1 to 2
reaction.
milligrams puts them
The
out,
steroids
and they
help
sleep
suppress
for
the
hours,
inflammatory
and then
process
others that
and
8 to 10
help with
milligrams
symptoms from
barely
recurring.
deadens the pain.
3. IV fluids are
Hypersusceptibility
also given
usually
to
results
replace
from
fluid
how
that
the
has
body
shifted from the
absorbs,
vascular system.
metabolizes, and excretes the medication, leading to a higher than expected level in the bloodstream. Increased receptor sensitivity can also increase the person's response to the therapeutic or adverse effects of the medication. Overdose is a toxic reaction that can occur when an excessive amount of a drug is consumed, either intentionally or accidentally. The result is an exaggerated response that can cause temporary changes or severe reactions that can lead to cardiopulmonary arrest and death. Ordering lower doses, protocols, and monitoring is generally the practice for special populations, such as the elderly, children, and people with chronic illnesses to avoid toxic reactions. Iatrogenic effects are adverse reactions that mimic pathologic disorders. Examples include aspirin and corticosteroids, commonly causing GI irritation and bleeding, especially when given together. Other examples would include propranolol-induced asthma and gentamicin-induced deafness. Sensitivity-related adverse reactions are not as common as dose-related reactions. There are 2 types: allergic reaction and idiosyncratic response. They arise from a unique tissue response rather than from an exaggerated pharmacologic action. A drug allergy happens when the person's immune system identifies the drug, its metabolite, or a drug contaminant as a dangerous foreign substance that must be neutralized or destroyed. Initial exposure to the medication or one of a similar chemical composition will sensitize the person's immune system. When the person is exposed to the medication again, he or she will cause an allergic reaction. This reaction does not only directly injure the cells in the tissue, but also produces damage throughout the body by releasing vasoactive substances that can constrict or dilate the vessels and histamines that cause inflammation. The allergic reaction can vary in severity from itching and a rash to a full-blown, life-threatening anaphylactic reaction. The problem is that you never know if a subsequent exposure when you have had a mild reaction will result in anaphylaxis. Quick intervention with an injection, Epi-Pen, followed by antihistamines, corticosteroids, and often IV fluids are necessary when an anaphylactic reaction occurs. It is imperative that you always tell the healthcare providers and the pharmacists about any allergies you have and what happens when you come in contact with the allergen. An idiosyncratic response happens when the person reacts to a medication and it is not due to the properties of the drug or from an allergy. This type of adverse reaction is specific to the person and sometimes has a genetic cause.
Even though an Epi-Pen uses a needle to administer, the rules in Chapter 65G7 allows you to give the medication in emergency situations. How to use an Epi-Pen. 1. Prepare. Remove the Epi-Pen from the clear carrier tube. Hold it in your hand with the orange tip pointing down. Remove the blue safety cap by pulling straight up. 2. Administer. Hold the person's leg firmly for administering to a young child or someone who may try to move during the injection. Push the auto-injector firmly into the thigh muscle until it clicks. Hold firmly in place for 3 seconds. I like to count to 10 to be sure there's enough time for the medication to be totally injected. Massage the injection site for 10 seconds. 3. Get emergency medical help right away. Remember, the Epi-Pen is an emergency treatment but doesn't fix the problem. The person could experience symptoms again in as little as 5 minutes. Call 911 right away. The person will need additional treatment for severe allergic reactions. 1. Antihistamine, usually Benadryl. An antihistamine stops the histamine reaction that causes respiratory issues, swelling, and drops in blood pressure. Oral doses work as well as IV, but they don't work as fast. Give the dose by mouth if ordered, and the person can swallow without difficulty. Be sure to let EMS know how much you gave and when you gave the medication. 2. Steroids, IV and PO. Steroids are initially given IV, then the doctor may prescribe an oral steroid like prednisone for a period of time after the reaction. This varies with the severity of the reaction. The steroids help suppress the inflammatory process and help the symptoms from recurring. 3. IV fluids are also given to replace fluid that has shifted from the vascular system.